Hola guys, happy Friday. I'm on my way to work. I'm gonna insert the audio of my doctor visit. I hope it sounds okay. One of the ladies was very soft-spoken, so I don't know if you all are gonna be able to hear her, but I hope you can because she was amazing. The entire staff, guys, is absolutely amazing. This center clinic is an advocacy group, a support group, along with a doctor's office, and I was very impressed. I mean, considering the condition is so scary, the fact that doctors like this and organizations like this exist are amazing. So I was very impressed by the staff. What I didn't get to record was the PA when she first took me into the room, because I didn't want to make it all obvious that I was going to be recording. Although I'm pretty sure if I'm not filming them I can, but I didn't want to make it all obvious. So the first introduction to the first staff member at that doctor's office was not recorded. But let me tell you guys, if she is the first face you see, if she is the first hint of the interaction and the experience you're going to have at this particular Baylor Scott and White, it's a good thing. Okay, so she started asking, you know, your vitals and everything, height, weight, history, and all that. And then she says, "Do you know why you're here today?" And I told her I'm here to see if the scans that were provided by my doctor show that it has spread. So I say it has spread because I'm like, y'all are a cancer center, you know what I'm talking about. And she's like, when you say it, what do you mean by it? I said I was just diagnosed with breast cancer, and I had to take this barrage of tests to see if it spread. She said, okay. She said, the reason I ask is because sometimes patients come in and they haven't been told their diagnosis. She goes, and I am not a doctor, so I don't want to divulge or say too much and you know, give news to a patient that they did not know. So she goes, so that's why I asked that. Okay, so just to make sure that you are aware. And I said yes. And then we were talking a little bit, and I started to cry. And then she's like, are you okay? And I said, I'm sorry, it's just the first time I've said that out loud to a person face to face. I said, I've called it the cootie, the disease, the C word. This is the first time I've said the word in relation to me. And she said, I understand it's very scary. She said, but we are absolutely here to support you, and we're going to make this journey as easy and understandable as it can be. And then she said, and I'm gonna need a hug. She said, I made you cry, I'm gonna need a hug. And I'm not usually one about touchy-feely with strangers, but the fact that she was so moved to offer a hug just again proves that she's in the right business, for one, and that this place gets it. You know, it's not just, so far it doesn't seem like it's just about money and claims and insurance and all that. So the visit started off very well. She gives me a hug, and then she asked me if I was feeling how I was feeling about the diagnosis. Was I afraid? Was I anxious? Was I, you know, how I was feeling? And again, I started crying a little bit. And she said, okay, she said, and the reason I asked that is, she said, because we have a wonderful support group here. I'm going to introduce you to lady's going to come in here. She'll be with you throughout the visit. And we offer, I'm sorry about saying a lot. She says, we offer a lot of services to our patients before treatment, during treatment, and even after in your healing process. She said, so I'm going to bring her in. And because I was kind of like, you know, I was sad and crying, so she was going to bring her in. So she's the next lady that came in, and I believe I was already recording when she came in. Now this is the really soft spoken one, but I really liked her, and I really appreciated how hard she worked to try and coordinate everything, because she understands that I start a new job on Monday, and she's trying to put as many appointments in one day as she can, so I'm not here and there and here and there and here and there. But I'm gonna let you all hear the audio. I'm gonna try not to edit it, just so you all can hear everything I heard, because I'm gonna need y'all to hear what I heard in case I forget some stuff. Then y'all can remind me. But if the sound quality is just really, really bad, then you're obviously gonna see some edits. But let's get into that, and then I will see you guys after. I am on my way to work. I'm about 15 minutes away. There was no way I was not going to be there today. Today is our going away lunch, because some of us, you know, this is our last day today at the clinic, and there's no way I was gonna miss that. I gotta take some pictures with my girlies. What is this, you guys? I gained 7 pounds. I've gained 7 pounds. I had lost weight when I started the Jardians, and I gained weight, but then I've been eating my feelings ever since the whole clinic debacle. So the clinic closing situation, and then I've just been eating a lot. So I definitely see it. But anyway, I'm heading over to work to say see you later to the girlies. Our little pregnant girl, was checking on me a little bit ago, and I told her I'm on my way into work, and is the food ready? Because we do like a potluck thing. And is the food ready? I was supposed to have bought my meatballs. My meatballs were requested, but I didn't, you know, I had to focus on this. I had to focus on the doctor appointment, whatever. But I will say, guys, I left there feeling better. I didn't get all the information that I needed. You guys will understand once you listen to it. I didn't get the information that I thought I was going to get, because there are still scans that need to be done. There is still information that the doctor has not received, even though he tried and I tried. There's still information that he has not received. So I wasn't able to come out of there with a definite plan, but the plan is still in the works. I was given a lot more information than I had, and I walked out of there feeling confident that I'm in good hands, confident that this is what it is, and we're gonna do what we gotta do. So on to the audio, y'all.
Hi, Miss Perez. I'm Stephanie. I'm the nurse navigator.
Nice to meet
You too. So Dr. Reddy will be in here in a little bit. I just kind of wanted to introduce myself and give you my name and number in case you need anything.
Okay.
I'm not always at my desk, but if you leave me a message, I always return your call.
Okay.
And just kind of, we're just kind of beginning your process here, so we'll see what Dr. Reddy recommends, and then we can, but I just wanted to give you some information. I do a support group. We meet the first Monday of every month. So if you'd like to come, I'd love to have you. It's very relaxed, very informal. Are you working?
I am.
What do you do?
I'm a scheduler for Texas Health.
Oh, okay. Which hospital?
Presbyterian.
Okay. Do you work from home or?
No, I actually worked in the clinic, and I just transferred because our clinic is closing. So they just transferred me to heart and vascular, so I can stay in the family without having to move on.
Oh, yeah.
And I start that new job Monday.
Okay. And where is that located?
It's on Walnut Hill.
Oh, so you drive quite a ways. Yeah.
Because I live right around the corner.
Oh no. Where was your facility before?
It's in the same place. It's all in the same clinic. So they're just transferring our
just from one
to a different
clinic.
clinic.
Yeah. Been there, done that. So, and nothing is set in stone anymore, is it?
And it's the timing of it. I have to walk in Monday to my new practice manager and say, by the way, in the last 3 weeks, this is what's happened.
Yeah. So, you live in this area?
Right around the corner.
Okay, good. So this would be a good facility for you. Okay. So we'll see what Dr. Reddy recommends here, and also if you need like any FMLA paperwork or anything like that, give me a call.
Okay.
Or I've got my number in there, and my fax is in there.
Okay.
If they want to fax me the paperwork, to protect your job and everything.
Because we started talking about that yesterday with the transition and all, like, oh home. I'm terrified.
Yeah,
That,
yeah.
of course, they won't say, "Oh no,
Yeah.
we gotta." Of course, they're not going to say that, but I'm just scared that something could happen.
Yeah, you know, I found that people, you know, FMLA works really well, and we'll work with you, and I really haven't had anybody who, you know, and since you do scheduling and that you don't have a real physical job, I think you'll be okay. You know, so what you do want to get that FMLA going to protect your job, you know, and so once we find out what Dr. Reddy's plan is here, then we can, because they want to know like specifics, like how many days a week, and we always ask for more than what you need, so that you're, you know, so that you're protected. You know, I know it's easy to say, try not to stress, but
I mean, when it comes to it, I'm gonna have to do what I have to do for all of this first. Before anything.
Yeah. So we'll try to work with you as much as we can, and we'll see what Dr. Reddy's recommendations are first. And have you had your surgery and everything?
I had the mammogram and the biopsy.
Okay. So we'll need to get you in with the surgeon probably, and go from there. You probably want someone locally, right?
Yeah.
Okay. All right. So we'll see what Dr. Reddy says and try to take one step at a time.
Just certain words like, whoa, it's real.
Yeah, and walking in this door means it's real too.
I started shaking in the parking lot, right? And like I'm holding on to faith, and I'm like, why am I? I'm not scared. Is it my faith? I haven't been scared. I'm sad, but I'm not scared. I'm not scared. And when I pulled out, my whole trunk just started. I'm like, oh gosh.
Yeah. Are you alone today, or did someone come with you?
I probably shouldn't have been.
Yeah.
Probably shouldn't have been, but everybody works, and my sister went with me to the biopsy, and I can do it.
Yeah.
Now I'm thinking maybe.
Yeah. Well, that's in all of us, you know. But then once you get here, the realization takes into effect.
Yeah.
So
it's very real.
Yeah. But just kind of let you know, we're here for you. We do have counselors available, nutritionists. We've got an exercise program here for strengthening. So, you know, we'll do whatever we need to do to get you through this. And, you know, most surgeries you're in and out in one day. You know, so
it's just the healing.
Yeah, and you know, depending on what type of surgery. I mean, since you have a scheduling job, they may let you go back pretty quick, depending on what they, you know, the extent of surgery and everything. Have you had any workup or anything, or any scans or anything?
Oh, everything. They sent me with my disc, with my mammo, I had a CT of the abdomen, CT of the pelvis, MRI of the breast, the biopsy, mammogram, ultrasound. And they sent me with all this just in case.
Okay.
These are my questions.
Okay. All right. Okay. Yeah. Okay. All right. Do you have a pen to write down?
Somewhere.
Here.
Thank
give
you.
Mine.
Thank you.
And then I'll be right back. Okay. All right. Okay.
Hello,
Hi.
this is Miss Melissa Perez.
Yes.
Dr. Reddy, how are you doing today?
You told me.
So, tell me, what do you have in particular?
They sent me with my discs, with everything. They
so,
you probably already have all that, but they sent me.
no, I don't have all of it.
Oh, okay.
That's why I want to take a look. So, you had breast mass?
Yes.
Okay. Did you find it yourself? This is Stephanie, the nurse.
Yes, I met. We
Oh, you
met.
met? Okay.
I did. I found it myself.
Okay. Have you been getting mammograms?
No.
Okay. When was the last time you had a mammogram?
Just that's the first one, I believe.
This
On
is
the
first one.
Yeah, that was the
Okay.
first
Anyone in the family with breast cancer?
No.
No. What other medical problems you have?
I'm diabetic.
Anything else?
No.
I see that.
My cholesterol's a little elevated just recently. It started creeping up.
And I see you had a history of blood clot, right?
Yes.
Okay.
In my left leg.
And how did that happen? Do you know?
Probably just sedentary lifestyle. I sit and work all day long. I was heavier at one point, so.
Okay. Do you have any complaints today, like pain or anything like that?
Just this normal arm ache that they said could be associated with the lymph nodes and all, but that's been going on for quite some time. I have limited mobility in it and it just aches.
Okay. Now, any cough or trouble breathing?
No.
Any loss of appetite, loss of weight?
No, I gained it.
Oh,
In the last
let's see.
2 months.
And any alarms anywhere else? When was the first time you felt or noted it?
August, the very first week of August. I started having pain in the breast mid-July, which was
Okay.
new. So I thought it was linked to my shoulder. Well, when I found it, I was massaging my shoulder because it was really hurting that morning.
Oh, okay.
And I'm in there massaging, and I
That's
felt
what
it.
I meant.
It's a big one.
Got it. Okay. So let me get you a gown. I'll step out and I'll be back.
Okay.
Do you have family?
Yes,
Oh, okay. Did you come by yourself?
I did today. And probably shouldn't have, but I
That's
did
okay.
today.
That's okay. Yeah. All right. We'll be back. Okay.
Just top?
Just
Yeah.
top.
Okay.
Oh, it's good, and then just open this in the front here.
Open in the front. Okay. All right.
And your bra, your top off.
Okay.
Bra. I'm gonna make copies of this and I'll be right back.
Okay.
Okay. Now I'm gonna pull it, before you sit
Oh,
down, I'm
sorry.
gonna pull this up so we can.
Oh,
There
okay.
you go, okay, there's your call over there. I'll call him there,
There's
get the
some-
final report, yeah.
We got some, but not all the marks. Where did you get the biopsy?
North Texas Imaging
Okay.
on Hampton.
Okay. Any pain in the abdomen?
No.
Any nausea?
No.
You work for Presby?
Mhm.
Oh, okay. Do you want to get your stuff done there?
I prefer closer to home,
Where do you live?
around the corner. I
Oh.
live here.
Okay. Yeah, no, that's fine. I'm just asking because
Yeah.
you said you work for Presby.
Yeah, they recommended, well, since you're here at work all day, I'm like, yeah, but that's a super long drive for any treatments and stuff if I can get home.
So get rest. I'll come back and talk to you what
Okay.
our next steps are going to be. Okay?
All right.
All right.
Whew.
What we have to do, as you know, you got breast cancer,
Mhm.
and the first step we got to do is do some scans.
Okay.
But that's for anybody with a new diagnosis of cancer. And we need to do a bone scan. Bone scan is to see if it has spread to the bones. And we need to do a chest x-ray if they refused a CT chest.
Okay.
When did they order those scans, do you know?
I don't know when they ordered them, but Imaging called me to set up my appointment, and then that's when she told me they didn't authorize the brain MRI or the chest
Okay.
CT.
So let me get the reports,
Okay.
see what all the stuff they have done. If not, we'll go ahead and order those things.
Okay.
That's one. And the second thing we need to do is you need to see a surgeon. All the breast cancer patients, first they need to see the surgeon. And you need to see the radiation oncology as well. And the surgeon, radiation oncology is right here. He's usually here on Mondays. We'll set you up to see them. Radiation oncology is not urgent. Their role comes later. The first step is complete the scans. Basically, we are trying to find out if it has spread anywhere else. You know it has spread to the lymph nodes here. You know
Yeah,
that,
that's
right?
all I know.
Yeah.
Mhm.
So what we are trying to find out is, has it spread anywhere else? This applies to any cancer. We initially do the complete scans. That's number one.
Okay.
And next step is you need to see the surgeon. And once the surgeon sees you, will decide what needs to be done.
Okay.
Most of the times, because of the size of your cancer and because it has spread to the lymph nodes, patients like you are first treated with chemotherapy first, and then surgery, and then radiation. Like those are the steps usually. If the cancer is small, like let's say less than an inch in size, and confined to the breast, then we do surgery first, and then chemo if needed, and then radiation. But the size of your cancer looks like at least above an inch in size, maybe close to 1.5 inch size, and the fact that it has spread to the lymph nodes, the patients like you are first treated with chemotherapy.
Okay.
The reason is the chemotherapy try to shrink it as much as they can.
Mhm.
That way it makes it easier for the surgeons to don't have to take out a lot of tissue around it. So that's pretty much the standard.
Okay.
And also the chemotherapy giving first has shown to improve the overall chance of being disease free and survival. That's why any patient with a cancer that's more than 2 centimeters inside, usually we do chemo first, try to shrink it, then surgery. As to what chemo you're going to get, that's where I need to get additional information on the markers.
Okay.
So that's why I need to get that additional information on the markers to see what chemotherapy you need, how much doses you need, how many cycles or you need, and also it depends on what the rest of the scans show. So right now I won't be able to tell you much about what chemo you get and what side effects to look for and how many cycles you're going to get because I don't have all the information yet.
Okay.
So that's where complete staging with bone scan and everything and a scan of the chest and rest of the scans. And so what we'll do is we'll start scheduling these scans and I will call around and see the surgeon. Do you have any surgeon in mind that you like to see?
Not
Okay.
cool.
So let me see who is available, who can see you sooner.
Okay.
And are you willing to go to Waxahachie?
I can.
Okay. Because there's a surgeon there, Dr. Gorman, she's good. But let me see if who is at Methodist Dallas. See, in this area, Methodist Dallas, Methodist Charlton, and Waxahachie, if you want to stay south of I-30.
Yeah, I just would prefer to stay closer to here for those treatment days, for that
Yeah.
type of thing. It's not so far from home.
Got it. Okay.
Yeah, and I'm very familiar with Charlton. I like Charlton. So.
Yeah, so let's find out who can get you. Let's see.
Okay.
So, referral to the surgeon, referral to the radiation doctor, and complete the staging workup with all the scans. As I said, you need a bone scan as well. All the patients with breast cancer need a bone scan.
Okay.
The reason is breast cancer usually spreads. I'm not saying it has spread in your case, but the common places it spreads is lungs, bones, and liver. That's why we always want to make sure we got all that information, because that could change the management if it has spread. That's why, again, we don't know that. I'm not saying it has spread, but we need that information.
Now the bone scan is a bone density?
No.
Okay. Okay.
Yeah.
Because they mentioned density. They put dye in me yesterday and laid me on the table. That was one of them. So many.
Yeah.
With the day that I had so many.
Yeah, bone density is looking if you have osteoporosis or not, whereas bone scan is looking if there's any cancer.
Okay.
Okay, so let's get these things, and I want to see you back in 2 weeks.
Okay.
By then we should have all the information,
Okay.
like the scans, the surgeon's input, and the radiation oncology. That way we'll have a better idea what the stage is based on the scans, and then what treatment options we're going to be looking at.
Okay.
So that way we can talk more. Okay?
Okay.
So right now, if you ask me, I would say it's stage 2 at least, if not stage 3, because it has spread to the lymph nodes
Okay.
based on what the information I have.
Okay.
But the scans will give us more idea.
Okay.
Because it has spread to the lymph nodes, depending on the size of the lymph nodes on the scans and the size of the mass, it could be 2 for sure, maybe even 3.
Okay.
If it has spread to other areas, it would be considered as stage 4. Right now, 2 or maybe 3. That's what I'm looking at right
Okay.
now. But we'll talk more once I get all the information.
Okay.
Okay, so that's where we are.
So, I'm so paranoid and nervous about being this ticking time bomb. I don't have to worry about.
No, this has been going on for a long time.
Okay.
A week or 2 or even a month won't make any difference.
Okay.
I know a
'cause
lot
that
of
was another
patients
one of my
once they get it.
questions. How long has that been there?
It's been there for a while.
I didn't feel it. I'm like, surely I would have felt something that big in the shower.
Once it gets to a certain point, then you start noticing it. Probably it's been there for a while. Usually most of the breast cancers, take like months to years to get to this point.
Okay.
Yeah. I mean, rarely there are some cases where it could be more aggressive, but most of the times it's been there months, if not a year.
Okay.
Yeah. So that's why I know I get a lot of patients get anxious and nervous that everything's taking longer. But if you ask me, treating today versus a month from now, will it make a difference? No.
Okay.
She starts a new job on Monday. The
I started
practice
a new
she's working for is closing, so
Oh.
she's going to be working with a cardiology group. So she's kind of nervous because she's got a new practice manager and everything. So.
And this
Yeah,
is the
and
conversation I'm going to have with her on Monday.
Yes, you're definitely. It's a good idea for them to be aware because you'll be going through a lot of tests, a lot of visits, and for sure you'll spending some time, away from the office for chemotherapies, and depending on how chemotherapy goes, you may be tired. So they need to know what. That's it.
So I definitely have more info now that I can provide her because I was going in blind, but I knew I'd get something. And so you're saying in the next 2 weeks,
I want to get all of
I'll
this.
come back here in 2 weeks.
Correct.
But between now and those 2 weeks before I come back here, can I get a call from the surgeon or somebody?
Correct.
Okay,
Yeah.
because I'm trying to get into my head how to prep my new practice manager.
Correct. Yeah.
Because I can say in 2 weeks I have an appointment, but if in the
between also
interim I
you'll
get an
have
appointment.
appointment with the radiation doctor,
Yeah.
surgeon, and a bone scan and a CT scan at the chest. In between also you'll have some appointment. Just be
Okay.
aware.
Okay.
Yeah.
Whew.
Okay. I know it's a lot of information, and we don't even have all the information. So we'll be talking more once we have all the information.
Okay.
Then I'll be able to give you a better idea. Okay, which chemotherapy medications, how many cycles, what side effects to look for, and all those details.
Okay. So then I can
And
save
next
my
time,
questions till next
Bring
time.
your family members
Okay.
if they want to be involved, or
Oh,
if
yeah.
you want them to. That way they
Yeah.
know what we're talking about.
Yeah, second set of ears.
Yeah.
Definitely. Okay.
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 All right.
Thank you so much. Well, guys, I made it through the day. It's been a day full of emotion, laughs, peacemaking, closure. It's so weird that I'm coming right back here on Monday, but it feels like I'm not. It was my last official day at this clinic again. This time it wasn't of my own choice, but I was able to make peace with the doctors that I was so upset with, the doctors that I blamed. Got a little bit of insight into what prompted them to make this decision to leave the clinic in limbo the way they did. It turned out it wasn't them wanting to leave just because they would have been shut down anyway in about a year or two, and they needed to think ahead. They also felt slighted by the hospital as a whole. They also felt that they had to make this decision, and they admit they're not ready. But they were put in a position where it was either go this route and continue practicing, or continue on in a system that they are not comfortable with. And it's not the first time, it's not the first physicians that I've heard say that when they went into medicine, it wasn't for this. They didn't go into medicine to tend to patients the way they're having to now. Now, granted, they still are who they are, They still have their ways about them, and I don't know how that's going to work out in a concierge type of situation. But I made peace with it. I understood them a little better. So I hope it works out for them. And I made peace with the lady doctor because yesterday my lead was, she asked if it was okay that she gets some medical, opinion or advice from one of our doctors, which we've always done. Okay, we've always, if we ever have any issues, any health scares, anything like that, we've always been able to go to the doctors we work with for advice, exams, stuff like that. We've always been able to. And my lead wanted some input from a doctor. We were going to go to the male doctor, But she felt that the female doctor, being as smart as she is and having been through something similar, would have more experience and better insight. I didn't know she had had a similar experience. Not too long ago, actually. So we went in there with her, and sitting down with her one-on-one made me remember what a good doctor she is. She can be quite the princess. She can make us want to pull our hair out. She can have her ways. But as far as her doctoring, all of them, all three across the board, their doctoring is really good. Even the ones who are upset with the male doctor and call him a popcorn doctor will call him a popcorn doctor and still praise him. And I've been hearing this a lot in the last few weeks. I'm like, hold on. In one breath you say he did it, but then in another breath, but he's fantastic. Which is it? And I've been hearing this, rolling my eyes and just whatever, just being mad about any praise towards either one of them that I did forget. They're good doctors. These people are upset that they're leaving for a reason. They're following them for a reason, those that can afford it. So yesterday I got most of the information in regards to why they're leaving from the female doctor, and I had no idea. I learned a lot yesterday, and she was very apologetic for the timing of it. She felt terrible. So I felt better, like I understood their situation better. I thought they were just leaving to make more money. No, they were put in a position where they had to do something. They had to do something fast, so they went in together and said, hey, we got to both jump off this ship. Why don't we jump together, see if we float? So they're trying to float, and it's not all, you know, it's not all easy. It's not all simple. I was kind of taking some joy in the fact that they don't have everything they need to start their practice. But when I talk to her, it's not anything to be happy about. This is a choice that they had to make. They had to make it, and they're not prepared. They admit they're not prepared. I am so glad that I talked to her, because now I see both sides. Just like our lead had asked her to see both sides of the coin, both sides of the lens, when she was upset that we weren't talking to her and all that, I needed to do that as well. So I'm like, I had no idea they were basically being pushed out. So we spoke yesterday, and then today when I came back, we had our all day long, we were just bullcrapping around, joking around, taking pictures, going down memory lane, just really taking it easy today. And she came out of her office and kind of leaned on the counter, and I looked at her and I asked her, would you like an update? She said, if you don't mind sharing it with me. I said no. So we went into her office, and again I got to see that doctor side of her. And you know, I just updated her, and she gave me a little bit of information, and made sure that anything that I may have misunderstood, she corrected. And what he said was this: did I understand correct? Yes, you understood correctly. So that was that. And then we started talking more about, you know, them leaving and all. And she said, have you talked to the guy? I said no. I said, honestly, my feelings were hurt. I said, and then here recently I've just been so hyper focused on getting everything in place. I haven't. And she said, I think you should go talk to him and at least go say goodbye, because he really misses you. Now mind you, me and this guy doctor were buddies. Okay, he's helped me through a lot of stuff, a lot of listening, a lot of medical stuff, he's a friend. That's why I was so hurt, because I thought we weren't just co-workers. He wasn't just some fancy Dr. Pants. He was our buddy, you know, he was our friend. So when she said, you should go talk to him since it's your last day, he really misses you. So that just touched me so much. So I went in there, and he's getting up to walk out. When he turns around, I'm standing there. And I said, "You're not going to say goodbye to me?" And he says, "Oh my God, I was just waiting on you. But no, I wasn't going to let you leave without saying goodbye to you." And he comes in for a hug. Now, mind you, he's friggin' tall. He's like 6 something. And I got one of those awesome hugs from him. And he says, "Everything is going to be great." And I don't remember exactly what I said, but I made kind of a joke about, yeah, everything will be great except for my boob. And he looks at me, he's like, "What?" I'm like, I haven't made the rumor mill yet? She said, "No." He said, "No, what are you talking about?" I said, "Oh my God." And I just straight out said, for the second time today, I was just diagnosed with breast cancer. And he's like, "What?" So we started talking, and he felt so bad, and he goes, "I had no idea." He felt bad that he hadn't known. And then I immediately felt bad that he hadn't known, because I could have really used his support. Don't get me wrong, the people I work with are so friggin' amazing. I've had nothing but cheerleaders. But it wasn't until that moment, because I've been so focused on making sure I get everything done, that I realized it would have been awesome to have been able to share some of that sadness and fear with him as well, because we are friends. So we talked, and he gave me a bunch more hugs, and he said, "I need you." He goes, "If they ever say words you don't understand, if they ever give you too much information, if you ever need to ask me anything, I can break it down for you. I need you to call me. I can explain things to you. I can break down things to you." And he says, "Please, and let's not just say this, I need you to keep in touch with me." So I got my closure with the doctors. We left everything good. But it's sad, because a lot of us, thank goodness, still have jobs in the hospital. Some of us even in the same building, just on different floors. So we're going to be seeing each other. But a lot of them I'm not. A lot of them still don't know what they're going to do. And a lot of them I'm just not going to see anymore, because they're going to be retired. And I'm new to this. Look, y'all say we're going to keep in touch, but we better keep in touch. I'm new to that. I'm new to that want. I'm new to that need. Before, whatever, But no, like, as close as I've gotten to some of the people since I've come back, and just how great these ladies are. I need to keep in touch with them. So we left, and we left laden with stuff, guys. Like, whatever was in our desk, whatever was in our area, whatever little knickknacks. I had my crock pot for our little when we have our little luncheons and stuff. Oh, our lunch today was delicious. My fluffy girl self will tell you about that here in a little bit. But all I was going to bring home, guys, was my crock pot. That was it. I was just going to bring home my crock pot. And I have this vase of pins. It's a big vase full of friggin' pins that I used to collect the years and years and years ago that I worked there. And when I left this giant vase of pins. And my coworker comes around the corner not too long ago and says, "Hey, you remember these?" She kept them, guys. So I said, "Hey, I'm going to take these home." This is before we knew the clinic was closing. So I've had that big old vase of pins. I tried to bring that home today, guys. I can't do it. We had way too much going on. Was carrying way too much. And granted, I only have one good arm right now. And then our little girl, the little pregnant girl, she was trying to help. I'm like, because she had her own big old bag. She's not leaving for 2 more weeks. But she had a big bag of food from her luncheon that she was taking home. And I don't want her putting that weight on her belly. So I put back the big thing of pins. I put back my crock pot, the only thing I was going to bring home today. And one of these cups. I put it back, and I'll be back. That's what I'm saying. I'm going to be right back on Monday. So at lunch or after work, I can just cross the Sky Bridge and pick up my crap. And I guess I logged out as best as I could. I think I did my time card the right way. I don't know. Our lead was guiding us through a lot of stuff, but there are some things that needed approval by our practice manager, and our practice manager has not been there all week. I didn't get to say see you later to her, but hopefully she's back Monday because I need to get my hug from her. Her husband has been in a very, very tender state all week long, had open heart surgery, and it's just the timing of things that are happening to so many of us in that clinic medically, either ourselves or our loved ones, a parent. It's spooky. It is so spooky. But it was a good day. I walked in and they were already lined up in the hallway getting ready to eat. So I walk in and some of them were surprised to see me there. A few knew that I was coming because a little girl had texted me wanting to know where I was. So a few of them knew that I was showing up, and I walk in and they're all in line. I'm like, ooh, y'all better wait for me because I am starving. I was starving, guys. So we get in line. Our lead said a beautiful prayer over us. She got us all in our feelings, and then she blessed the food, and then we ate. So let me tell you, okay, our lead's husband makes the best barbecue, okay? He made ribs, he made wings, she made all the fixings for a nacho tostada bar. There were cookies and cakes and sodas and fruit trays and just delicious food. Like, we ate to the point where we were miserable for a good hour after. But I meant to ask her for that prayer. It was so beautiful. And she had it typed up. I definitely want a copy of it. But yeah, I have bags of random things. And between me and little pregnant girl, we're walking that quarter mile from our building to the parking lot. We had to stop 3 times. Me with the bad arm and her with the baby belly. Like, oh, and today was the first time, guys, that I saw the belly. In her scrubs, you can see a little pooch. But on Fridays, we get to wear regular clothes. And she had on jeans and a little shirt. Oh my gosh. And I'm going to miss that. I'm going to miss... Oh man, I'm going to miss the baby belly growing. I'm going to miss seeing her waddle around. We're not going to be able to have our baby shower for her. We're not going to be able to celebrate birthdays together. We're not going to be able to go through this together. Even though they were like, girl, what you talking about? See you later. Yeah, because they're going to be with me through it. I've already been promised that. But we were supposed to do so much together. This perfect crew that we had. And we can't now, but it's okay. And I just want all the good things for them. I want the health of their loved ones to improve. I want a healthy birth for a little girl. I want peace for those that are super anxious about what they're going to do. I want everybody to fall into a happy, peaceful place. Like I said, I'm going to get to see some of them throughout the hospital, but I'm going to miss so many of them. But I'm heading home. I'm telling little dude when I get home. I'm going to keep it positive. I'm going to tell him all I know. Let him know that I'm not scared. Let him know that we're going to lean on God. Let him know that if he has any questions or is afraid or whatever, he can come to me. He doesn't have to keep anything to himself. And then I'm going to ask him if he wants to go to the movies because Conjuring starts today. Chihuahuas. Conjuring starts today. And the last Conjuring wasn't as good as the other. But it's around Halloween, and y'all know we watch scary movies, and scary movies are one of the few movies he ever wants to watch. So we're going to have us a little movie date. And we'll go from there. Gotta get him his nuggets. So I'm going to get him his fast food Friday. And then we'll head out to the movies, depending on how he feels. If he is too scared or sad or worried or whatever, I can always tell by his face. He's not much for words, but his face tells everything. So if he feels up to it, we'll go to the movies. But I'll see you guys when I get home. No, let's go ahead and cap this one, because I honestly don't know how long it's gonna be so far. But I just wanted y'all with me throughout the day. So until my next go around, I don't know what I'm gonna get myself into. I need to get out in that yard. Did y'all see what that yard looked like? I need to get out in that yard, keep busy, get some exercise. It's good for me. So I'll see you guys very, very soon. But until my next go around, I love y'all bunches. Bye.